Everyone, this is Chris from Restore Muscle Therapy in Canberra, Australia. This is about femoral nerve pain, and I treat this quite a lot, and it can be very debilitating if it's not treated properly, or if someone's stretching their hip flexors, thinking that's helping. I've seen 3 people go to emergency doing that because of pain, to get pain relief. So the femoral nerve comes off L1. L2 to L4, so this region just here, and it branches off, goes through all the psoas muscles, the hip flexor muscles, all through here, and branches through into the quad. And what people feel, they've got this numbness or tingling down the thigh, the front of the thigh, the side of the thigh too, because another branch comes off the side of the thigh here too, and into the adductor, and it can feel like it's pinching in here too. And this here is the psoas. So the psoas muscle comes off all the lumbar spine here. When it's really tight, it will compress these vertebrae together. The nerve weaves through the muscle, innervating the muscle. The muscle gets tight. Whenever nerves get tight, muscles get tight. So a way of releasing a nerve is to actually release the muscle through different bodywork techniques. And it'll have trigger points where these locations are, trigger points in the rectus femoris muscle. And pretty much all this referral here is this is a muscle referral, but also people feel this with femoral nerve issues too. And on the skeleton here, so we're looking at this lumbar area here, that's T12, L1, L2, 3 and 4. These levels here, the nerve comes out of, so these nerves here come out, innervate the muscle that fills here, muscle that comes through here, connects to all these vertebral bodies, comes through underneath here and connects right onto this little bony protuberance here, the lesser trochanter. And it'll cause the pelvis to want to rock forward because the hip flexors get tight. It'll make the back feel really tight too. Sometimes people feel the glutes get really tight and sore at the back. Essentially, femoral nerve compression is the opposite to sciatic nerve issues. So nearly everyone's aware of sciatic issues, which is coming off this area here. Muscle gets really tight here and causes pain or tingles, numbness down the back of the leg, usually into the outside of the foot here. So femoral nerve is kind of the opposite. It's the same thing, but it's on the front of the leg rather than the back of the leg. And I'll put up an exercise that you can do to help take away femoral nerve pain. Main thing is to see someone highly skilled at dealing with that problem. And it needs to have neural flossing techniques and nerve glide techniques for the femoral nerve. Lots of muscle work through here. Also checking if there's issues in the neck or the jaw or the tailbone as well. And do not stretch your hip flexors thinking it's going to make it better, because it'll make it worse. And it can make it worse about 4 hours later.